While hospitalizations remain somewhat stable in the Basin, patients from rural areas have been transferred to MCH and ORMC.
When it comes down to a patient level, it depends on what the patient needs. Every hospital has different equipment, different nurse skill sets. So depending on what the patient needs is where the patient's going to go.
In the rural communities, it's not so much about capacity. It's about how ill a person is. If they need a critical care intensivist, they're going to have to go to Midland, Odessa, or Lubbock. And Andrews County residents are used to that. Rural healthcare, it's one of the reasons I went to school to be a nurse practitioner. I worked in Crane County for several years, and that's really what inspired me to go to nurse practitioner school. It was, they just don't have a lot of providers. Sometimes they struggle to keep ER shifts covered, but I really think nurse practitioners are pretty well designed to help fill some of those primary care needs in these rural communities.
Because of how vast the property is in West Texas, there's a lot of land to cover. So it takes a long time just to travel to our outside communities. So I wouldn't say that they're underserved, because we do have that relationship where they can be sent over here and we could take care of them. So staffing has always been an issue, and us being so rural and frontier out here, it's always been an issue. Our hospitals in our region have been doing really well with their capacities. I know that some of them are now developing their own small COVID units within their facility to keep some of their folks at home. But capacity hasn't been a problem. The majority of the problems have been staffing, and that's been one of the problems at Medical Center as well. Having the nurses that have the appropriate skill set to take care of these critically ill patients are sometimes hard to find. having a doctor or having the nurses that you need in the areas that you need, because they're so low populated. And then, there's, other than the oil field, there's not a lot of other industries that happen out here. So keeping that kind of skill set here is very difficult. The state of Texas has done us a big favor whenever we have situations like this. They've created teams within Texas that if, say, medical center got into a situation where we need critical care nurses and we're in the middle of a disaster like what's happening right now, they will deploy those teams from other places in Texas to come here and help us. And right now we have filled out the paperwork, and we are receiving some nurses from that request. So with rural healthcare in West Texas, we do try our best to keep our folks as close to home as possible, just because it does put an extra burden on the family whenever we do have to unfortunately send somebody far from home, like if they go to El Paso or Dallas. So we try our hardest to keep them at closest to home as possible, and then if they are moved, then we try to offer things like what is that house called where we, like, if the babies are in NICU, they can stay, what's it called?
Ronald McDonald?
Yeah. So most hospitals do have something like the Ronald McDonald Home, or they have RV spots or things of those natures that we could offer to the families whenever they are displaced with their family member.
There are no intensivists in the rural areas. We're a lot of times very lucky to find family practice and internal medicine physicians in rural areas, let alone a surgeon in a rural area. It just doesn't happen. They're in more populous areas like Midland, Odessa, Lubbock.
What happens is a patient will go into an ER at one of our rural partners hospitals, and they will be seen by a physician and a nurse. They'll go through a full assessment, and that's when the physician in the ER will make the determination of, yes, we can handle it here, we're going to keep them here, or no, they might need a little bit higher level of care, or maybe a piece of special equipment.